Namaste to all of you. It is indeed very heartening to see that such a session has been organized, which is very pertinent to today's time. And as a family physician, I practice in community. I practice in the suburbs of Delhi NCR in an area called Noida Extension, and we have high-rise society where we have middle class, high middle income families living, and this is process is happening across India. We have metropolitan cities and smaller cities are also developing. So society time is also changing. Economically, we have a very big middle class. So traditional discussion on child abuse, we heard today from the perspective of thoughts from different stakeholders' point of view. But family physician's role is the physician in community. So I will partially share my own experience and partially also in a form of how family physician can act as safety net towards prevention or saving children who are in the situation of child abuse. And we have heard what is the definition of child abuse, what are the types of child abuse. So I will not go into that detail. I want to start with discussing the context and the locality. Context is the community. And when we talk of community, we all know about the tip of iceberg phenomena. So every child that is brought to or presents to institutional care like hospital or police station or judiciary or a juvenile center, there is a iceberg phenomena to this, and there are thousands and thousands of other children who are in the situation of abuse and who are not recognized through the institutional process. So of course, when we talk about law, when we talk of hospital care, when we talk of medical care, we are largely covering the children who are in the upper part, who are the visible part of the abuse morbidity which is prevalent in the community, in the society. So as family physician, we are used to saying normal patients many of the times. Often families visit with their children, parents come with the children, children come with their parents. So all these situations gives us and puts us in a special interface where we are seeing a lot of normal families. They are not in situation of any acute care requirement. They often come for small problems like cough, cold, hypertension, thyroid, common things. And what is our observation in that situation? I would like to share. So we talked about actual abuse signs, hidden signs, symptoms of abuse, physical abuse, for example, are different. But what I want to emphasize is the common things, like even a case of dog bite, whether it is a at home animal injury or at outside peri where habitat or around the area where the children play, go out or walk or stroll in that area, if they even if they have dog bite or injury. So injury is the common problem with the parents bring children to the family physicians. So why does this injury take place? Often this is because of neglect, because children are not developed enough, not mindful of what the risk might be there in dealing with the environment within home and outside home. So they are always at risk within home for injury, in kitchen, in bathroom, in drawing rooms, in situations of falls, in situations of crush of finger, cut, electricity, all these things, situations we have to make our home safe. If we are not making our homes and surroundings safe, that is the first, we are, we are exposing them to, all kind of physical abuse, which is, injury. So it is not just, intentional injury that happens, but unintentional injuries that may happen in home and outside home is also a kind of I would consider an abuse. And nowadays, time is very important, because we see people, as I said, society is changing. So we are living in nuclear families, and often the support of the joint family is not there. So in the joint family days, we used to leave our children with the other family members. They used to be safe, they were protected by their siblings, extended siblings, chacha, tau, mama, masi, all these kind of situations, they were left safe. And but that system of our families is shrinking, and we are left with with more of many times single parents, also many times nuclear families, where there is very little time for children. So child rearing also requires time. And the newer trends that you see, that children are often left with unattended laptops, mobile phones, earlier with TV, and this kind of not giving enough time to children is also kind of abuse, I would say. It is unintentional. Many times it is not avoidable, but leaving a child with mobile phone just for playing, and I've seen, in very early childhood nowadays at my clinic, while, the parents are coming for consultation, they have given children their mobile phones to watch cartoons, or even if they want to please their children to have food, they will encourage them to watch mobile phones, and things that is normally this not used to be the case of previous generation. So the time is entirely changed. So when they are exposed to internet, even for adults, it is very toxic. If you watch the reels, the types of reels, it is very toxic environment that we are living in a digital world. It is very difficult for even adults to keep their mind aligned to a neutral position moving forward with sanity. It is difficult for children to decide what content is right for them and what content is not right for them. There is a system of supervision inbuilt all IT digital systems, but we often do not take care of that. And many times children would be exposed to unintentional content which is not good for their age, and they are not also good for any age actually. So digital toxicity, is very, very important these days in respect to child care, child abuse, and we should be mindful of those things. I'm talking from the perspective of families that come to us, that we see in a day-to-day practice that is happening. Another form of abuse that we observe is with respect to food, because our food pattern is also changing, and there is conventionally we all used to cook in our own kitchen and have food together, and children would learn feeding practices at their home. But these days they are learning their food practices is also coming from outside peer groups and their schools, and also within homes. Many people are feeding their children things which are not common there, which are not health friendly, fast foods, chips, kurkure kind of things, and chocolates, overfeeding with things which are not nutritious, actually harmful. Many times they are not medically even certified in terms of food value. They are being fed to the children just for the sake of taste, or just pleasing them, or trying to overcome their tantrums or things like that. So food, giving them not right food and nutrition. One part was earlier when somebody was not given enough food or enough of calorie or protein. You used to talk about protein, calorie malnutrition. But this kind of overfeeding, feeding wrong things, feeding things outside, delivery, food delivery is very common these days. And many couple who are working, many times they are entirely dependent these days. I see many families which are entirely dependent on outside cooked food, and home delivery of food is very, very popular. In such situations, we are also not only making mistakes for ourselves as adults, which is leading to unhealthy trends, but also making food choices for our children. We are exposing them foods that is not healthy for them. So all these things are new trends in my understanding in child abuse, and we should be mindful when we are talking about. And this is also tip of the iceberg, as I said, part of the abuse process. And we have to be mindful and also try to address these things in an institutional way, at least in the academic way, that we have to articulate that these are also problems which are happening in our society, and this is how our society is evolving, developing. It is a dynamic situation. It is evolving, and we have to be very, very sensitive about situations. And then in nuclear families, we again have domestic violence, intimate partner violence, these situations where parents are not talking to each other, children are living on their own. This is again a form of neglect which we should, as family physician, these come to us, and they are very subtle symptoms where we have to find. And often these things do not present directly, but when we are examining or interviewing children or their families, we can sense that there is something wrong with this family, with this child, with this parent, with this partner, and we have to identify those things. Most of the times, is in our practice, we do not see patients or children or families which immediately required police care. I mean, in policing, in sense of law and legality, because largely these are social level of neglect, cannot even be defined or articulated in a breach of law. But these are also areas where we have to act and work and counsel the family, or anchor the family in a way that they are able to modify their lifestyle for the benefit of the children and overall safety. So we have to extend safety net in a comprehensive way in 360 manner, where we have support of all stakeholders. When we talk of law and legality, it is a very part of a very fraction of our society, because Indian society is not largely dependent on government. Government has a very partial role in defining the lifestyle, culture, popular choices of the families and the people. It is unlike the Western societies in Europe or America, or very structured society where everything is dependent on state policies. People in India is an open culture, and we have largely societies living independently of the government policies. So it is a situation where law enforcement will come rarely into picture, and we have to be mindful when this has to be intervention level. And practically most of the time it would be socio psychological, partially medical things that we see in our society as physicians, that what we can do. And potentially, because family physicians are part of the society, they're also considered part of the extended families. They give advice, and people listen to the advice of their family physicians also. And many times women come to us and say that, you please tell my husband not to smoke, not to drink at home, not to bring sleep at late nights and things like that, because they understand that once it is doctor gives advice, my family member or my partner would understand or listen to this kind of things. They also come to us and say that, sir, please advise my daughter not to behave like this, not to eat food like this, and eat to try to eat good food, or healthy food, or don't eat for outside. So because they know that the family members many times do not listen to each other, but they listen to their personal physicians who are. So family physicians role is very trustworthy in society. Their role is more powerful than police inspector, because we do not go to police stations. We go in a situation where actually there is a physical breach. But in normal situations, family physicians role as a counselor is very important. So it is important that as family physician we train ourselves with the legalities, with counseling skills. Of course we have medical skills, but these all should come together, and often this traverses across all age groups. So it is not just about counseling the children, but it is also counseling the parents, the extended family, and the society in the community. A lot of dog bite cases we see, it is all because of the society's neglect at large. And largely we see the age group of the children who are the victims of this situation. Why a stray dog should bite a child on the street, and how we can make our communities safer. We have families which are shrinking, but where do our children go? They go in school buses, they go to schools, and they go to parks, they go to play, they go for tuitions. All these places should be safe for them, and they go to clinics, they go to hospitals, they go to all kind of institutional situations like hostels, and all these situations should be safe for the children point of view, from all four domains of physical abuse, mental abuse, emotional abuse, sexual abuse, and neglect. So getting right food in hostel is very important. Right emotional support in hostel is very important. So be it hostel or home, every place should be safe from all domains perspective, and we should try to capacity build our family physicians, and family physicians have capacity to build the capacity of the community in sense of the community leaders, family members, all across age groups, teenagers, even elderly people come and ask us for our advice for their family situations. So this is the role of family physicians, primary healthcare physicians in the context of child healthcare. I've tried to bring it to more contemporary things that we are observing, and of course the institutional things have been discussed, and we need a integrated interface which is provides a larger safety net for our children of our country. Thank you all. Thank you for this opportunity. Thank you very much.